Welcome to the red carpet and to this year's Woman of the Year event. So I want to start just for a moment to ask you to say your name and your title and your company for the benefit of the camera.
Okay. Hi, I'm Joanne Golankiewicz. I am the Vice President of Commercial Effectiveness at Novo Nordisk.
Well, I hear that you've been very effective in terms of inspiring women's leadership. So your question that I would really very much like to hear your response to is, how do you feel that you've inspired other women to embark upon their path to leadership and have impact in the ways in which healthcare is changing today?
So I like to think that I lead by example at Novo. I'm a member of WIN, which is our women's network. So I help plan activities to bring in young women and let them know that they have a place in our company and give them the confidence to move ahead. I also lead a Lean In Circle within our group. We started that earlier this year. And I mentor a number of young women in Novo Nordisk. I think the biggest part is to inspire confidence in them. I like to think that I lead by example in terms of my style, my management style, and I particularly, with my team and the women on my team, encourage them to take risks, put them into projects and positions that allow them to expand their leadership and expand what they do.
So let's focus for a moment on the word expand. What have you done and found successful in terms of inspiring women to consider other possibilities, other aspects of their own career and their own skill sets that they could utilize in reaching out to impact health? Because women tend to previously, and not that long ago, work in a fairly small number of areas, but now it's much more expansive, and I would imagine that you've encouraged women to spread their wings and recognize what their possibilities are.
Yeah, so I think at Novo, and especially within our group is very analytically oriented, so people like to tend to stay where they feel comfortable, and encouraging them to take other opportunities within other parts of the organization. We've had a number of women move from our group into our diabetes educator program. So in terms of diabetes, patients are our first thought, and helping bring the knowledge that they have from our side over to the patient side so that we can improve patient care is really important. We've also had a number of people move into our managed markets area. So managed markets and the payers are a huge influence on healthcare these days, and allowing women to move into that and bring their perspective, and especially again from our side, from the analytics side, to help encourage them to move into that area and make a difference.
Okay, I'm going to throw you a little bit of a curveball trick question right now.
Okay.
I really do think that women lead differently, and we already know they think differently. So can you think of anything, either your own personal experience or one of the women who you've mentored, where as a woman leader, it's resulted in a different kind of decision and impact on the healthcare delivery to patients?
So I think, I would look at one of my colleagues. A couple years ago, Novo Nordisk didn't even have a patient-centered group in the company. She came into the organization as one of the brand managers, and she put together the business case to say that we needed to have a specific group and a specific area focused on the patients. She was able to take that idea to our VP of marketing and then to our executive team, and now we have a group of people that's about, I want to say, 50 to 60 strong that is leading patient initiatives to help improve patient care.
I couldn't think of a more perfect example, because that's what I would focus on as well, that women as healthcare decision makers think first of the patient. So
Right.
Thank you so much for sharing that with us.
Thank you.
Thank you.
Thank you very much.